Hi you guys, it's Carolyn from Reno Sore. I am here to share with you my 3 favorite exercises for the neck and the upper back as far as preventing neck and back pain and also managing upper back pain and neck pain. So first I want to review why these are important. As most of you know, I am a health and wellness coach and an integrative physical therapist. And so there are many principles that are important in reducing pain and preventing pain. I've narrowed it down to 4: eat well, move well, sleep well, and soar on, purpose and connection. You can find out more about those specific principles in Soar into Health, where you can also get some more specific exercises and ideas, and even on nutrition and sleep habits. But today I'm going to share with you my 3 specific exercises that are my favorites, and they are from the McKenzie Institute. You can visit their website for more information about the MDT McKenzie training in mechanical diagnosis and treatment, of which I am certified, at the mckenzieinstitute.org. But these 3 exercises are to help folks with very common poor habits as far as posture, either with using your phone, your cell phone. People are here for hours on end, especially kids. Or folks who have to work on the computer a lot, and they tend to be here. We've all seen this before and found ourselves in this position. And the idea is to kind of come out of that, reverse those curves, to restore the normal movement and keep the joints and muscles healthy, and reduce neck and upper back pain. So the first one is cervical retraction. Okay, so think of a chin tuck. We've spent all this time trying to avoid the double chin, which is why a lot of people stick their necks out, but we actually want to produce a double chin. Okay, so get yourself into an upright posture and slide your chin back. And you should feel a little bit of stretch on the lower part of the base of your head, and feel those muscles contracting in the front and even that double chin. After doing a few of those, you want to add in some overpressure, so long as you don't have any jaw pain or TMJ trouble. Okay. The key with this exercise is keeping your chin level so it's not going up or down. So think of it like it's a drawer in a set of chest of drawers or on a shelf. So you're going straight there. Okay. The second exercise is that plus neck extension. So you do retraction and then neck extension. Notice I don't hold that chin retracted when I go into the extension. You release it so that you're looking up at the ceiling and back behind you. To add overpressure to this one, you add a little we call it a waggle, where you rock your head just gently back and forth a little bit to take the joints just a little bit further. You should feel some pressure maybe in the center of your spine, particularly if you're getting to the end range. If you're having any neck pain or symptoms into your shoulder or arm, especially numbness and tingling, I strongly encourage you to follow up with a healthcare provider to focus in on the treatment strategies. So the third one is to work even more onto the upper back. So we started at the top, we're kind of combining everything, and now we're working on that lower up. Okay, so that upper back. So again, you want to be up nice and tall. You're going to clasp your hands behind your head, because the idea is to move this area, not the neck. And you lead with your elbows up. And to add overpressure with this one, you can scoop back to the end of your chair, so the top of your chair gives you some overpressure, and again lead with the elbows. These exercises can be done sitting, although you can start to incorporate them, even while you're driving. If you notice while you're driving, you're hunching, You just get the old chin tuck in, and that's safe. Obviously, don't do the other ones, but you can incorporate these in different ways into your life. As a general rule, I recommend people do a series of movements and exercises every hour that they are awake, particularly when they're sitting in front of a computer as their job. That you get up, you walk around your chair, you do a few series of exercises, including the 3 neck exercises that I just mentioned. And you can incorporate some other exercises that I've also discussed in my book, Soar into Health. So thank you for joining me today. I'm just trying to share a few tips that will help everyone's body stay healthier and stronger in the long run in today's world. And these few little changes can have a really big impact as you start to incorporate those few movements, particularly in the neck and the upper back in health. More exercises in Soar into Health, and thank you for joining me.